Hello everyone, welcome to sqadia.com. I am an educator, Dr. Lara M. Munir, and today in the infectious disease part of the internal medicine course, we are going to talk about a viral disease which has become a pandemic worldwide. It is the coronavirus disease of 2019, or abbreviated as the COVID-19 disease. As we all know that this disease has become a global pandemic, and it has almost spread to all the countries in the world. And so it is very important for the medical students and the medical graduates to have a good understanding of what this disease is all about, what are the major manifestations of the virus, and what are the various important clinical features. We are going to talk about majorly about the clinical features, and in the start I'm going to give you a brief outline of what this disease, the history of this disease, and about the genome of the virus, and then we are going to discuss in details the clinical features. So first, let's understand the terminology. The term COVID-19 basically stands for the coronavirus disease of the 2019. In December 2019, in the Chinese city of Wuhan, there appeared some abnormal findings. The doctors there experienced some abnormal findings. There was a cluster of patients who presented with symptoms of pneumonia, which are basically the dry cough, fever, and somewhat upper respiratory tract symptoms. So they became a bit suspicious that suddenly this cluster of patients, they are appearing from nowhere. So when they investigated, and later on it was found out that it was start of basically an epidemic from that city of Wuhan, and it was then later on traced back to a livestock market in the Wuhan city, where there were some animals, live animals, which were being sold and were used for dietary purposes by the Chinese people. So from there on, this disease was termed as a separate entity, and later on it was found out that it is a special virus which was initially named as the novel coronavirus. As we all know, that coronavirus basically is a family of viruses which have been present for a long number of years. It has different types of viruses. Recently, about 15 to 20 years back, there was another epidemic of SARS virus, which was also a type of coronavirus. That SARS virus, which basically stands for the severe acute respiratory syndrome virus, it is now labeled as the SARS-CoV-1 or the SARS coronavirus 1. It also had the similar features, and there were about 700 to 800 mortalities worldwide because of that disease. And now this pandemic, which has basically evaluated on a larger scale than the SARS coronavirus 1 epidemic, and this is now labeled as the SARS coronavirus 2 pandemic, or basically the severe acute respiratory syndrome coronavirus 2. So it is from the same group of viral family. There was also a small epidemic which was named as the Middle East respiratory syndrome, or the MERS. So all of these viruses, they basically have similar clinical features, have similar genomic patterns, and they are labeled under the family of the coronavirus. Now let's just briefly talk about what are the important genomic features of the coronavirus. Coronaviruses are basically the upper respiratory tract viruses. They are an RNA virus group of families, and their genomic feature was very closely related to the beta coronaviruses, which has been found in certain types of bats. So it is hypothesized that the start of this pandemic can be traced back to some people basically consuming bats in their diet, and that might be the trigger point that initiated all of this infection. And from that transmission, it basically evolved into a human-to-human transmission. Since it is a respiratory disease, it basically spreads via droplet infection. So if you are in close contact with someone who has a coronavirus disease, and if that person sneezes or coughs on you, then you might get affected. So it is basically suggested that you maintain proper distance of around 6 feet from someone who is already diagnosed with a coronavirus disease, or someone who in the present circumstances is presenting with the classical signs and symptoms, which we are going to talk about in the coming slides. And those patients are basically advised to quarantine themselves so as to minimize the spread of disease to the other people. So based on this general background, and you are going to see various sections on our website regarding the genomic features of the disease. With this background, we progress on towards our next slide, which is basically the major topic of discussion, which are the clinical features and the clinical manifestations of coronavirus.